Pay attention to this sign, as it indicates a thyroid condition. There are signs suggesting you might have a hormone imbalance, either hyperthyroidism or hypothyroidism, where the thyroid doesn't produce enough T3 and T4 hormones. I'll explain the symptoms and 5 key thyroid facts that most people get wrong. This can significantly impact your treatment and diagnosis. You might be misdiagnosed if you're unaware of the info I'll share in this video. Let's start with the signs and symptoms. Remember, this applies to both extremes. So, what's the first sign of a thyroid problem? It's swelling. This swelling can occur in the legs, but also in other body parts, especially the face, which is more typical. Many people come in with swollen faces. This requires immediate investigation of thyroid hormones. This change mainly occurs in hypothyroidism. It's a harder swelling, medically termed non-pitting edema. It can also appear in other body parts, as I mentioned. In hyperthyroidism, with high thyroid hormones, this usually doesn't happen, but it's a major red flag and requires investigation. The second sign, quite controversial, relates to weight. Do you think thyroid issues cause weight gain or loss? You've surely seen lots of information about this. The thyroid can cause weight gain, typically 4 kilos due to swelling. Your metabolism slows, you're less active, and daily tasks become harder. So yes, thyroid changes can lead to weight gain. On the flip side, hypothyroidism can cause weight loss, which is a much more noticeable change. Weight losses of 20, 30 kilos, or 15 to 20% of body weight are common. I've seen even more. Your metabolism speeds up, appetite changes, leading to weight loss. So yes, this is a very significant change. There is indeed a thyroid condition that causes weight loss. In this case, it's hyperthyroidism. The opposite can happen too, but it's much milder. What's the big controversy? After treatment, when your blood levels are normal and tests are good, weight changes can't be blamed on treated thyroid disease, okay? This is also very common. Many patients say, I heard thyroid doesn't affect weight. Oh, but it certainly does. If you're treated with stable levels, it's key to discuss. Don't just treat incorrectly. With stable levels, you can't blame weight on thyroid issues, but it's worth noting that this situation does exist and is true. The third sign, changes in heart rate. I want to highlight this because I often notice these changes during physical exams. And what are they? Did you know the heart has receptors for thyroid hormones? So, with excess hormones, the heart beats faster. That's called tachycardia. It feels like your heart's in your throat, pounding. That's over 100 beats per minute. The opposite occurs in hypothyroidism too. As the heart has receptors, when hormone levels are low, bradycardia can occur, with heart rates below 60 requiring investigation. Often, people have had thyroid issues for months or even years before diagnosis, so they've adapted to the symptoms. When someone has had a condition for a long time, their symptoms may decrease. This is serious and shouldn't be ignored. If your heart rate isn't between 60 and 100, you should get your thyroid checked. Patients often think it's a heart issue and see a cardiologist when they actually need thyroid tests. Did you know that? If not, your like was worth it. Let's aim for 10,000 likes. If you're not subscribed, I invite you to subscribe and keep watching our videos. So let's continue with the video. Number 4 is fatigue. You wake up tired, struggle with daily tasks. This happens at both extremes. Why does it occur in hypothyroidism? With low hormone levels? Hormones affect the brain. With low levels, you feel drained and can't enjoy life. This causes metabolic changes, leading to fatigue and other long-term issues. Indeed, fatigue is a major sign of potential thyroid problems. Tiredness can also occur when we have excess hormones. Why? You've seen that this change can cause weight loss, but it's not healthy weight loss. It's muscle loss, making you more tired. Not to mention the heart will beat faster too. See how everything's connected? This can lead to that fatigue. Do you struggle climbing stairs, for instance? You could climb 4 flights before, now one tires you out. So it needs investigating. Remember, not just heartbeat, but thyroid changes can cause heart failure. A thyroid issue can lead to heart problems. The 5th sign is hair loss and brittle nails. Interestingly, this often prompts patients, especially women, to seek help. They may tolerate heart symptoms, but when it affects their hair, it becomes serious. I'll never forget a patient who had thyroid issues for a while. She had previous test results, but didn't return to her doctor. Those tests were from 5 or 6 months ago. She had symptoms for a long time, but when her hair started changing, she said now it's an emergency. So she sought help. It's crucial to be aware of hair-related symptoms too. So hair loss and nail changes are easier to spot, okay? This can happen in both hypothyroidism and hypothyroidism. Sign number 6, present in almost all thyroid cases, is memory changes and forgetfulness. Are you watching this video and have a thyroid problem? Comment if you've experienced forgetfulness, like doing something and then it started, right? Forgetting what you were doing. Many report this. It's rare to have thyroid issues without these signs, especially forgetfulness. Remember, if not corrected or identified, this can even lead to dementia. It's an irreversible cause of dementia. This is crucial and needs to be discussed, as treatment is necessary to prevent worsening. Sign number 7 is the worsening of other conditions, like changes in cholesterol levels. Did you know that decreased thyroid hormones can lead to higher cholesterol? Changes in triglycerides and blood pressure can occur in both hyper and hypothyroidism, as well as alterations in blood sugar levels. This applies to those who were stable. I often hear patients say, "My cholesterol was always 100, but suddenly it's 180 or 190. Without any diet changes." That's a red flag. The same goes for blood sugar levels. If your well-controlled A1C suddenly spikes without lifestyle changes, that's concerning. It's a warning sign that may indicate a thyroid issue. Sign number 8 is bowel changes. Our intestines have receptors affected by thyroid hormones. Excess hormones can cause diarrhea and faster digestion. Conversely, low hormone levels may lead to constipation. It's important to note your usual pattern. Compare your normal habits to recent changes. If there's no apparent cause like diet, investigate thyroid issues. The 9th and final sign I'll mention is a change in libido. There are other symptoms, but this one's crucial. Thyroid disorders can decrease sex drive. Why? When the thyroid can't produce hormones properly, the pituitary gland increases TSH, the thyroid-stimulating hormone. This can also increase prolactin, which may interfere with sex hormones like FSH and LH. LH stimulates testosterone production in the testicles. In women, this can cause menstrual changes, lower libido, hormone imbalances, and even infertility. Did you know that? So, testosterone, prolactin, menstrual cycle, and thyroid function all need to be evaluated. If you're trying to conceive, check your thyroid. Sometimes other treatments overlook TSH and prolactin levels, which are crucial. It's worth noting that increased prolactin can cause milk discharge from nipples, known as galactorrhea. This can happen in men too. Did you know that? Remember I said women often notice hair loss first? For men, reduced libido or nipple discharge are signs they'll seek help for. I often end up diagnosing thyroid disease in these cases. What are the 5 mistakes and tips I'll explain in this video? It's crucial that you know this. The first tip is about supplements, especially multivitamins for hair and nails. Did you know some multivitamins can affect thyroid test results, especially those containing biotin? Biotin can cause errors in the tests. It can increase free T4 levels and decrease TSH levels. This often leads to confusion. Actually, biotin doesn't cause illness, but it can alter test results. If you're having thyroid tests and taking vitamins, especially biotin, tell your doctor to stop 72 hours before to avoid interference. I often see patients with abnormal results, and when I talk to them, they're taking biotin. These supplements have become really popular lately. Be careful to avoid misdiagnosis, or if you're ill, supplements might mask it and show normal results. You could have the disease without being diagnosed. Think about that. So, it can work both ways here. This is a serious issue. When taking the test, you should say, "I take these meds and vitamins. Any interference?" The second key point, for proper thyroid hormone production, iron is crucial. Did you know that? So, iron deficiency or low iron can impair thyroid hormone production. You may not have thyroid disease, but low iron can hinder hormone production. It's vital to treat and normalize iron levels before checking thyroid issues. Often there's no autoimmune cause like Hashimoto's or Graves' disease, just an iron problem. So, iron levels must be evaluated too. Did you know that? Probably not. Really? And number 3 is about Lugol's iodine. I hear about this every day. As I often deal with thyroid issues, the Lugol's iodine topic is quite delicate. Why? Many non-specialist doctors arbitrarily prescribe Lugol's iodine, which is extremely dangerous. Did you know that 1 drop of Lugol's iodine can contain 10 to 15 times your daily iodine requirement? And what are the consequences of excess iodine? It can saturate the thyroid, causing hormonal issues, even hypothyroidism. I see this often in my practice. Recently, I treated a patient who was taking 5 drops of Lugol's iodine daily. As you've seen, even 1 drop can cause these changes. Short term, it can increase production, leading to hypothyroidism symptoms, which can be very dangerous. Am I against Lugol's iodine? No, that's not the case. There's a medical use for iodine Lugol. For example, doctors may prescribe it to reduce bleeding risk in thyroid surgery. So it has a purpose, which is why it's produced. But it's not for supplementation. Taking iodine Lugol as a supplement is a mistake that can harm your thyroid. I often get YouTube comments asking, "Have you tried iodine Lugol? What happened?" Many people relate to this. It's important for others to read these comments and see that it really happens. Many videos here talk about iodine Lugol incorrectly and arbitrarily, which is a serious health risk. And tip number 4 is about thyroid tests. Did you know that in most cases, over 90% of the time, only 2 tests are needed for diagnosis, TSH and free T. Other tests like anti-TPO, tryptophan, and anti-thyroglobulin are needed for specific cases or when diagnosis is unclear. There's also reverse T3 and free T3, which may be requested for specific issues, but the routine tests are the 2 I mentioned. I often hear the doctor knew nothing about thyroid because they didn't order reverse T3 or free T3. Actually, excessive unnecessary tests show a doctor's lack of expertise. Ordering everything can lead to false results, causing more confusion than help. Interesting, right? So yes, these tests have their place, but they're not routine. Got it? And number 5 is about chlorine and foods harmful to the thyroid. Have you heard that pool or shower water can contain chlorine and harm your thyroid? You've probably heard this before. Or that eating broccoli can affect your thyroid function. This is also a myth. Pool chlorine, shower chlorine, and eating broccoli or cauliflower. There's no scientific evidence that these harm the thyroid. Low-quality animal studies exist, often just in labs, but human studies haven't proven this. Theoretically, pure chlorine could cause issues, but occasional pool swims won't affect you. These days, there's a lot of talk about diet and thyroid. There are many myths about it. I could make a whole video on this topic. Would you like that? If so, comment below and I'll share the best and worst foods, plus facts and myths about diet and thyroid. Also, rate this video from 0 to 10. What's your score? If it's a 10, I'll make more videos like this one. Did you know that after 40, we start losing muscle mass? This process intensifies as we get older. In this video, I share 8 tips to maintain and even increase your muscle mass. It's crucial to watch, especially if you're over 60. Then it's absolutely essential. Click this video to watch it now. Thanks, and see you next time.